Hi America, good afternoon. This is Dr. Rick Redalen coming to you from Colleyville, Texas. I'd like to talk to you a little bit about healthcare in America again. One of the problems we have in the United States right now is we're the only industrialized country in the world that does not have a single payer system. I listened to some little firebrands on television at night talking about that, and they say single payer systems don't work. They evidently work every place in the world except the United States. And let's take a look at that. If some of you are fortunate enough to see that little blonde, cute firebrand on television at night by the name of Liz Wheeler that does the program, The Tipping Point, I think you get an idea from her talking about this, that single payer systems don't work. But let's look at this. Why don't single payer systems work in the United States, but they work for every other industrialized country in the world? I think all you have to look at our senators and our representatives. Almost all of them are paid for by Big Pharma. And as we all know, Big Pharma is one of the most rapid growing businesses in the world right now, and especially in the United States, where they charge us double and triple and quadruple the prices that they charge the rest of the world. So really the United States is paying to support the rest of the world for their medications. And Big Pharma says, well, it costs a lot for medications over here because of research and development. When it comes to research and development, much of that money is provided for by our government, and they just don't ever bother to pay us back by giving us less expensive medications. We can buy a medication that probably costs them 50 cents to make, and they'll sell it to us for $400. The cost of medicine in the United States has become so prohibitive that many people are dying because of lack of care. They simply can't afford the cost of different medications. When it comes to medications like insulin that cost hundreds of dollars, you cannot expect a poor family that is not making ends meet to go without food to get their insulin. So what happens? We end up with all the complications of long-standing untreated diabetes, such as blindness, amputations, and all the multiple other problems of atherosclerosis that go with that, and we end up paying for that. An excellent example is a person that in the winter time has no boots. It'd be much less expensive for us to buy him a good pair of boots to walk through the snow rather than let him freeze his diabetic non-feeling feet and end up with amputations. And then we not only pay for that surgery, but we pay for the prosthetics and all the care that follows. Think of all these things when you think of single payer systems. We don't have a single payer system in the United States because it's wanted that way. This is the way that all the special interest groups make their money, and they're going to keep on making money off American people as long as they can keep a single payer group out of the mix. Again, this is Dr. Rick Redalen coming to you from Colleyville, Texas today. It's cold and windy out here. I hope you're blessed, and I hope it's warm and sunny where you are. God bless you.